Welcome to the NCLEX Success Tutorial on Celiac disease. Description: Celiac disease is an autoimmune disorder characterized by an abnormal immune response to gluten, a protein found in wheat, barley, and rye. This immune reaction damages the lining of the small intestine, leading to nutrient malabsorption and various gastrointestinal and systemic symptoms. Signs and symptoms include gastrointestinal symptoms, chronic diarrhea or constipation, abdominal pain and bloating, gas and flatulence. Systemic symptoms: fatigue and weakness, weight loss, anemia due to iron deficiency, osteoporosis due to calcium and vitamin D malabsorption, dermatitis herpetiformis, skin rash. In children, celiac disease can also lead to growth delays and failure to thrive. Nursing management: educate patients and families about gluten-free diet requirements and sources of hidden gluten in food products. Encourage regular follow-up appointments with healthcare providers for monitoring and assessment of nutritional status. Provide emotional support and counseling to help patients cope with dietary restrictions and lifestyle changes. Monitor for signs of complications and collaborate with the healthcare team for appropriate interventions. Surgical management: surgical intervention is not typically indicated for celiac disease management. However, in rare cases of complications, such as severe refractory celiac disease with intestinal damage, surgery may be considered. Management: strict adherence to a gluten-free diet is the cornerstone of celiac disease management. Avoidance of all foods and products containing wheat, barley, and rye. Use of gluten-free substitutes such as rice, corn, quinoa, and certified gluten-free oats. Regular monitoring of nutritional status, including vitamin and mineral levels, and supplementation as needed. Education about cross-contamination risks and safe food handling practices. Collaboration with dietitians and nutritionists for meal planning and dietary guidance. Parent teachings: educate parents about gluten-free diet requirements for their child and how to read food labels effectively. Provide guidance on ensuring a balanced and nutritious diet despite gluten restrictions. Teach parents to advocate for their child's needs in school settings, social gatherings, and restaurants to avoid accidental gluten exposure. Encourage open communication with healthcare providers for ongoing support and management. Complications: malnutrition and nutritional deficiencies due to impaired absorption of nutrients. Osteoporosis and bone fractures from calcium and vitamin D deficiencies. Increased risk of other autoimmune disorders such as type 1 diabetes and thyroid disorders. Dermatitis herpetiformis, a chronic skin condition characterized by itchy, blistering skin lesions. Celiac crisis and management. Celiac crisis is a rare but severe complication of celiac disease characterized by acute gastrointestinal symptoms such as severe diarrhea, dehydration, and electrolyte imbalances. Management involves hospitalization for fluid and electrolyte replacement, nutritional support, and close monitoring of complications such as metabolic acidosis and organ dysfunction. Let's look at the overview and description. Necrotizing enterocolitis, NE. Necrotizing enterocolitis is a serious gastrointestinal emergency that primarily affects premature infants. It is characterized by inflammation and necrosis, tissue death of the intestine, especially in the ileum and colon. Signs and symptoms: abdominal distension, swelling and bloating of the abdomen, bloody stools, presence of blood in the stools, which may be mixed with mucus, feeding intolerance, inability to tolerate feedings, vomiting, or gastric residuals, apnea and bradycardia, episodes of slowed breathing and decreased heart rate, lethargy and hypotonia, weakness and decreased muscle tone, hypothermia or hyperthermia, abnormal body temperature. Systemic signs: poor perfusion, metabolic acidosis, and sepsis-like symptoms in severe cases. Nursing management: monitor vital signs, regular assessment of temperature, heart rate, respiratory rate, and blood pressure. Evaluate abdominal signs, measure abdominal girth, assess for distension, and document bowel sounds. Assess stool characteristics, monitor stool frequency, consistency, and presence of blood or mucus. Provide NPO status, maintain nothing by mouth (NPO) status to rest the bowel and prevent further complications. Intravenous eye fluids, administer IV fluids to maintain hydration and electrolyte balance. Monitor for complications, watch for signs of sepsis, perforation, and multi-organ dysfunction. Collaborate with healthcare team, Work closely with physicians, surgeons, and other specialists for timely interventions and management. Surgical management and age. Surgical intervention may be necessary in severe cases of NEC with bowel perforation or necrosis. Age for surgical management varies, but is typically considered when conservative treatments fail or if there are signs of bowel perforation or extensive necrosis. Surgical procedures may include bowel resection, ostomy creation, and drainage of abdominal abscesses. Management, conservative. Management. Initially, NEC is managed conservatively with NPO status, gastric decompression, antibiotics, and supportive care. Parenteral nutrition. IV nutrition may be provided to maintain nutrition while the bowel heals. Gradual feeding advancement. Feedings are gradually reintroduced once the bowel shows signs of improvement. Close monitoring. Continuous monitoring of clinical status, laboratory values, and imaging studies to assess bowel integrity and healing. Parent teachings. Educate parents about the signs and symptoms of NEC and when to seek medical attention. Discuss the importance of following healthcare provider recommendations for feeding, monitoring, and follow-up care. Provide emotional support and guidance during the infant's hospitalization and recovery process. Complications. Bowel perforation. NEC can lead to bowel perforation, which is a life-threatening complication requiring immediate surgical intervention. Sepsis and shock. In severe cases, NEC can progress to systemic infection and septic shock. Short bowel syndrome. Extensive bowel resection in severe NEC cases can result in short bowel syndrome, requiring long-term nutritional support. Educate parents about NEC, its signs, and the importance of timely medical care and follow-up. NEC is a critical condition that requires prompt recognition, nursing management, and collaboration with the healthcare team for optimal outcomes. Nurses play a vital role in early detection, supportive care, and parent education to prevent complications and promote infant well-being.